Allogeneic stem cell transplantation is the only curative option in myelodysplastic syndromes, high-risk myelodysplastic syndrome, but there are several issues which are still open in the context of allogeneic stem cell transplantation. One of these is whether it should be performed upfront or after a short induction using, for example, hypomethylating agent or cytotoxic chemotherapy, or whether it should be performed up front. Some of the important points is that it has been shown that patients with higher blast counts at the time of transplantation tend to relapse very early after transplantation. And there is a time which needs to be bridged using something, and this time is between 3 and 8 months, and it's the time required for the logistic and the organization of the transplantation and the search for a donor. Hypomethylating agents have been used, and chemotherapy also, but prospective studies are lacking. There are a few prospective studies using chemotherapy, but the rate of transplantation following chemotherapy was very low, about 20%, and this was due to relapse or to worsening of patients' clinical condition between chemotherapy and transplantation. We performed in Italy a study to assess feasibility of allogeneic stem cell transplantation after hypomethylating treatment using azacitidine, and we were able to show that about 74% of the patients with a donor could undergo allogeneic stem cell transplantation using azacitidine as a bridge, and the response to azacitidine was a significant prognostic factor for survival for the whole patient cohort, and also and there was a trend for improved survival for patients after allogeneic stem cell transplantation. A further advantage of hypomethylating agents in general is that it might target very unfavorable patient subgroups like TP53 mutated patients, since it has been shown that azacitidine can induce responses also in this patient subgroup, and the number of mutated clones or the percentage of mutated clones decreases using decitabine during several courses of decitabine. So the combination of hypomethylating treatment plus allogenic stem cell transplantation might be favorable, but we need to compare the two treatments doing a randomized prospective study.